And it turns out one of the mutations in cystic fibrosis is responsible for about 4% of the population. By the way, cystic fibrosis is about 30,000 people in the United States, about 70,000 in US, Europe, and Australia. This particular mutation, where a glycine is mutated to an aspartic acid in one particular position of this protein right there, turns out that that mutant gets to the surface of the cell almost 100%. And when it gets there, it works almost 0%. So we said, we're going to find a molecule to make this mutant protein work. This is the mutant that we should be able to get to work. Because we'll be able to see the activity pretty well. So it's 0. It's pretty easy to see if something's not 0. Well, long story short, too long for this talk, we found such molecules. One of the generics name is Ivacaftor, and it does exactly that. In this graph, in concentrations of Ivacaftor that go down from here, but about micromolar or submicromolar concentration, we're actually getting chloride transport across actual human lung cells cultured from a G551D patient. But I'm going to show you an assay that I believe a lot more even than this one, which was an assay that I suggested because I said people who want to understand this disease want to see a picture, not a graph. They all aren't as smart as you. And so I'll show you an assay that I had developed that is now one of the favorite assays to explain this program. This is a cultured layer of cells from a G551D mutant patient. So volunteer got lungs, or unfortunately probably a child that died, and we got a piece of the lung. And what you see here, I think you can see even in this room, a little bit of movement there. Can you see the little bit of kind of movement in the slide? This is a cultured layer of cells. They're actually cultured just like a lung. They have an inside and an outside. And the cilia, the little hairs on your lung cells that try to beat and push gunk out of your lung are trying to beat, but they can't beat, it's too dry. And we can prove that they can't beat enough to be functional by putting little latex beads on top of the same surface that are fluorescent. And those beads are just sitting there. We use latex beads because they're exactly the size that is the most common size that you need to get out of your lung every day. You need to get grams of gunk out of your lung every day. You breathe it in Boston, and you breathe it in whether you live in Boston or Aspen, Colorado. There's all kinds of stuff in the air, gunk's off your lungs. You got to get it out and swallow it. So that's not happening in these cells. But if we put this compound, Ivacaftor, on these cells, this is what they look like. If you can see movement there. And most importantly, and this is the money slide, there's what the latex beads do. Not only are they moving, but they're moving together, they're moving in one direction. And if that was a lung, that's out. So we took the actual lung cells from a patient, we put a drug molecule on it, and we're reversing the macro defect by reversing the biochemical defect.